Well, welcome. Tonight, we're going to talk about an area that most people don't understand, most insurance companies don't really like, but becomes critical when you need this kind of service. And we want to go through the whole area of being a chiropractor. So why don't we start with introductions?
Super. I'm Nick Julian. I've been practicing chiropractic in the Franklin area and Milford area for the last 33 years. I'm a graduate of Palmer College of Chiropractic, which we could talk about at another time if you like, because it's the first chiropractic college in the United States. And I started here in Milford for working for Dr. Nunzio Benito, if you remember him. You must. And
I'm Dr. Mark Mazzuchelli. I'm also a chiropractor. I went to the second oldest chiropractic college, National University of Health Sciences. Graduated in 2014. So I've been practicing for about 2 years now.
he's about the same age I was when I opened my practice a while ago. Yeah.
Yeah.
But he doesn't have to call Paul Revere to borrow the horse to
No, he
ride his
doesn't.
office.
No, not at all anymore. Things have changed so much, and since I started practicing, mostly from computer and social media, has really changed the way that we practice and changed the way that we get to touch our patients.
But this is wonderful because, you know, you think about long-time Milfordians.
Yeah.
You're both from deep. If I call it the other Mazzuchelli family, Jamie will get mad at me.
Yeah.
But, you know, since my daughter went to school with Paul and Cookie's son,
Yep.
Andrew,
Yep.
that was always the Mazzuchellis. And
Right.
your family became, well, that's his brother, the other Mazzuchelli.
That's right.
But both families have been here for...
Long time.
Couple generations.
Yes.
Yeah,
least.
finally, I told my daughter Alexa she's finally passed the test to be a true Milfordian. She's third generation Milford,
Yes.
and she lives within 2 miles of her mother.
That's a beautiful thing.
Yeah.
Isn't it?
You don't move too far.
It's a beautiful thing. That's one of the nicest things about growing up and living in Milford. It's that can happen, that you're not far from your family and not far from your cousins, and it's beautiful.
Well, but
I
it's
love
even not even cousins. I mean, you know, you think of the Mazzuchellis for us. Well, Cookie and Paul, I mean, it's like an extended family. You've known them because his son was in school at the same time and went through 12 years with my daughter. It's kind of hard not to consider. And, you know, and they're such nice people.
Yes. it's
You know,
true.
that whole group that you grow up with, either on the soccer field or the football field or somewhere,
Yeah.
they become an extended family.
It is. That's the nicest thing I think about Milford, is that the whole town is pretty much an extended family. And you're right, though, it takes a long time to become a real Milfordian.
You know,
So-
and my darling bride and I always had this argument because she moved here 28 years ago.
Yes.
And she keeps saying, I'm not a townie. And I laugh because the Milford paper comes out, or Kevin Rudden, you know, the crier comes.
Sure.
She's the first one to grab it and start
Yeah.
seeing what's going on.
My wife too, and she's from New Jersey, and in Baltimore, and in a number of places when she was growing up, and she's been here for now 15 years, and she feels a part of the community, but she doesn't feel that she's a Milfordian quite yet.
Yeah, like I say, you got to be at least 2 or 3 generations,
Yes.
and you have to live within 2 miles of your mother.
Yes.
Then you get the check mark.
That's right.
That's right.
That's right.
So explain to me, because when you say chiropractic,
Yeah.
I don't think people really understand. You know, you get these shades of, okay, you're going to grab my neck and make very loud cracking
Yes,
noises.
yeah.
But that's not what it's about.
It isn't. You know, the thing about chiropractic and the thing about medicine, we grew up watching Dr. Kildare on TV. There's all sorts of commercials about medicines and the drugs that we use today, and and that is ingrained in us, what medicine is. You never saw a show about a chiropractor, except maybe that there's one show that had a chiropractor.
The
in it.
2.5 Men.
2.5 Men.
Right.
It is.
Yeah, but he
that's,
wasn't
that's
a-
not much
wait a
of a.
minute, I was
that's
gonna
a-
say,
And they made fun of
you
him
think of
too. They
Dr.
made fun of him
That's-
too.
Dr. Kildare.
Yeah.
I go through these
Marcus
role models,
Welby.
Marcus Welby,
Yeah,
MD,
and we get the guy.
and then you get the goofy guy
yeah,
that was
on
always
2.5 Men.
right.
It was a goofball. But anyway, so it's easier for people to relate to medicine and what medical doctors do than it is to relate to chiropractors. There's a lot of old wives' tales too about what chiropractic is. But it's really quite simple, right?
Yeah. Basically, what I do as a chiropractor is I motion palpate the spine, meaning I press and look for restrictions, an area where the spine, your spinal joints are joints. They should have movement in them, like your elbow. So basically what we do is we find areas where there is lack of range of motion, lack of movement in those joints, and restore motion back into them. We call them restrictions. But basically that's what we do. We go up and down the spine, and we find the areas where people are lacking
Okay,
motion.
so that begs a question. One, how did my spine get restricted? And then how do you unrestrict it?
So to unrestrict it, we apply a downward force usually if you're or prone on your stomach. And as you breathe out, usually, we go in and follow you in with your exhale, and we give a quick thrust. And we bring it to its end range of motion. The quick thrust will break through that restriction. And sorry, what's the other question?
How did it get restricted?
How to get restricted is daily activities, the way you sit, maybe you favor one side, and the joint complex basically kind of locks up. You want to add?
Your spine has individual vertebrae in them.
And a little cushion in between.
In between that. So each of those vertebrae can move within a prescribed range of motion, independent of the one above it and below it. And through our normal daily activities and through motion, sometimes those vertebrae can not misalign, but kind of get stuck so that they're not moving through that full range of motion. It could be something simple. It could be bending over to pick up a pencil, or something a little bit more crazy, like playing hockey when you're 52 or 53 years
59,
old. 59 years
yeah.
old. So those are all ways that the joints of the spine can become fixated. Chiropractors, a lot of chiropractors call that a subluxation.
The older term. We were trying to get a little away from that nowadays.
Well, the subluxation is a big deal amongst some chiropractors. Another way that chiropractors have kind of shot themselves in the foot is that they argue amongst each other about what it is that we do and
But
how
you
we
have
do it.
two vertebrae and a disc in between.
True.
How does it lock? I mean,
Well, it's not just vertebrae and a disc. There's tendons and ligaments and muscles and nerves and all those tissues can cause a decrease in its normal range of motion. It's kind of locked up. It's not locked up like a lock and a key, but it's kind of just not moving through its full range of motion. So when it does that, it can cause swelling in the joints. There's swelling in the posterior joints of the spine. And that can cause compression on nerve roots or other tissues that surround it that can cause pain and discomfort. And what the chiropractor will do is try to find those areas where there's fixation and a decrease in motion in those specific joints, and then deliver a thrust to push the joint through its full range and allow it to move normally.
but if you have an inflammatory response, you're kind of crimping the movement.
Yes. Yes.
So,
you still
I
have
mean-
to push it through.
Okay.
You still have to push
It's
it
a quick.
through.
It's not a long-lasting. When you adjust, it's a quick motion.
But do I need to take an anti-inflammatory if?
Most chiropractors would prefer to do the manipulation without the use of any kind of medication whatsoever.
Which is a good thing.
It is.
It is, yeah.
But if you're going to ask me, I would take it. Sure, because it helps. It reduces the inflammation in and around the joints. It makes it easier for us to deliver a thrust and also to get the joint moving through its full range of motion. So yeah, use every tool that we can. We can't prescribe medications. We can't prescribe anti-inflammatories.
An anti-inflammatory like ibuprofen.
Yes,
I had a shooting pain. It felt like a nerve going down my leg
yes.
when some little whippersnapper hit me, but good.
Yeah.
And I got home, and of course, you have to listen to your darling bride because she's always right. And
Yes.
if I ever question it, I ask her, and she says, "No, that's correct."
That's right. Happy
It's the
life,
correct
happy
as-
wife.
Yes.
Yes.
And she had me taking Advil all day for like 5-7 days.
Yep,
The inflammation went down.
it does.
It does. That's what the job of those NSAIDs, non-steroidal anti-inflammatory drugs, Advil or ibuprofen does. It decreases the amount of inflammation systemically throughout your whole body, decreases it down. And inflammation
then
causes pain.
If you put it back,
Well, had you gone to the chiropractor, you probably would have only had to take the Advil for 2 days instead of 6 or 7.
isn't that funny? I never thought of going to get chiropractic help for a nerve.
Why would you, unless somebody that you were familiar with, or that within your family, or someone that you trusted had gone and said, Al, you should probably try this and see what happens.
See, if you had moved from being next door neighbor, I could have gone out and asked you.
That's
in
it.
the backyard, I would have
That's it.
known.
And that's how most of our patients come to us. They don't come to us because they saw us on TV. It's because someone in their family or someone that they trust, a friend or a relative, suggests, well, you know, I had a similar complaint and I went to the chiropractor and it helped me. Now, could you take an ibuprofen or an Aleve or something of that sort? It may help, it may not. If you came to the chiropractor, you might only have to take it for a day or 2. And remember, too, you're taking medication. There's always some unseen possibilities that can occur with medications, even as innocuous as Motrin.
Yeah, but you're popping 4 Advils into the stomach,
Yeah.
into a pH3 buffer.
3 times a day.
Right.
3 times a day.
I mean,
So,
it can
yeah,
have,
it
you
can
know,
have
you
an
get the
wreak
warnings,
havoc,
an
yeah.
adverse
make sure
effect.
you eat to buffer it
That's
out
right.
or else.
That's right. So stuff can happen from taking the medication. Chiropractic is generally very, very safe, and it can move things along much quicker.
Yeah.
Much quicker.
And another question you have to ask is, why do you have that inflammation in the first place? Why is that inflammation getting out of control? A lot what I learned in school too, just getting into it now in chiropractic school, is inflammatory foods that you eat that can increase that level of inflammation in your body. So another component as what we do is we kind of try and find out what's causing that increased amount of inflammation. Either if you're doing something wrong or you're eating something wrong, we can kind of modify.
Well, what kind of foods? I mean, I know what caused my inflammation. I think the technical term is stupidity. It's getting on the ice with a group of 20-year-olds
Yes.
who bounce
Yes.
and not realizing that when they bounce me, I splat.
Yep.
Yes.
So I knew the root cause.
Yep.
Yes.
But if, like you say, I just went to grab a pencil,
Yes.
I mean, people bend over and pick up things.
All the time, all day long.
So what kind of foods
So
could
it can
exacerbate
be, it can
this?
be foods. It can be an injury, like you're talking about, can cause inflammation, locally and systemically. Stress causes inflammation. But in terms of food, what foods cause
Yeah,
inflammation?
I mean, if somebody was to say, okay, what should I try and avoid?
Yep.
We know carbohydrates make rotund people.
Yes.
I'm in perfect case. I'm in the dictionary. Rotund. They put my picture.
Me too.
It's very simple.
Me
But when you think of, I don't think most people look and say, oh, is that an anti-inflammatory?
Yes, and that's how we looked at it in school with nutrition. We had a wonderful, Dr. Seaman was our nutrition professor down in, I went to Florida, down in Florida. And that's what we were studying, is the relationship of omega-3s versus omega-6 fatty acids. And
So fishies?
fishies, fatty acids. So omega-3s, fish oil, is loaded with omega-3s. Omega-6 fats are grain-fed fattened animals. So that's why they say grass-fed meat is good, because it has a higher level of omega-3s versus grain-fed animals. So omega-6 fats, and also omega-6 fats and sugar. Sugar, like you said, carbohydrates, directly turn on inflammatory mediators in the body, sugary foods. So it's best to avoid those at all
So
possible.
now I walk into Shaw's or wherever I go. The meat's in packages.
Yeah.
Well, let's see. How do I know that was a grass-fed bovine or that was? I mean, to me, it all looks like hamburger
Yeah.
or steak.
Yep.
I think pretty much in Shaw's you're going to
Yeah.
you're going to get the grain-fed
Okay.
cattle, but at some stores like Whole Foods,
Whole Foods or?
they'll label it as grass-fed.
Usually they label
or-
it now, yeah.
Yes.
Yep.
So you'll know that, and this is a realm of chiropractic that the young guys are really paying attention to
Yeah.
and counseling a lot on. Me as an old-time chiropractor, you know, someone come in with a hurt, I found it and pushed on it and send them home.
See, I could see my darling bride, my daughters, when they go to Kumbaya Whole Foods, they probably understand that. They
Yeah.
don't like me going shopping because I always thought you take a shopping cart.
Yes.
You're done shopping when the cart's full.
Full. And there's potato chips and
Oh, yeah.
pretzels and all that good stuff in there, and
That
ice
was-
cream. And,
That was
yeah,
called
so-
it. You see, once you've been married 100 years,
Yeah.
you got a ways to go. You'll find that the term cheating on your wife is waiting till she travels and then going down to the store and buying the potato chips and the cookies that you know better.
Gorging
Yeah.
out.
Yeah,
Because you can't have them in the house.
that's right.
Or you do as my son-in-law does and hide stuff in my pantry.
So that he can come to your
So
house
when he
and have
comes to
it-
visit,
Yes.
he'll nibble on those.
Yeah. My dad does that. My dad's 94, and he goes out and buys Snickers, and he'll hide them in different places of the house so when his wife goes off, he can find them and have a
My
little
problem
dessert.
is, if I try and hide anything in the house, Sharon finds it.
Yeah, it's
You
pretty
know,
good.
she
Yeah,
knows.
she's pretty good.
And she's really raised doubts when she says, "How did this show up?" I said, "The dog." Must be the dog. Ask him, see if he'll deny it. He will not deny it.
He'll just stay quiet. He
Yes.
doesn't say a word.
So long story short, you want an ideal ratio of 3 to 1. So 3 to 1. So omega-6, you're always going to get a little higher omega-6 in your diet to 1 omega-3. And that's why fish oil comes into play. You can increase that ratio, make it more optimal to a 3 to 1.
Yes, you have those
Fish oil.
nasty tasting
Yes.
fish oil, big,
Big things, yeah.
yellow tablets.
And that
or
will decrease
capsules.
the systemic level of inflammation in the body. That's why that's important.
Important for your heart.
And
as
other
well.
things, yeah.
You know, especially if you have a familial history of heart disease. That all helps to keep all the plumbing clean. Inflammation is thought to cause lots of disease
Yeah.
associated with.
You know, but you get to a
with
point where
atherosclerosis.
after 50, they say, you're an old man.
Yes.
That your thromboxane levels are going to
Yes.
be an issue. Take a baby aspirin.
Yes.
It's the only medicine I know of that's dosed out
Yep.
on a per human basis. Usually
Yeah.
it's so many mgs per kg or whatever.
Yeah.
Baby aspirin is, you're an old man, take a baby
Yeah, take a
aspirin.
bag. Yep.
And take one of those foul tasting, fish oil.
Fish oil.
Omega-3.
Yeah.
Yes.
Sometimes they tell you to take 3 of those.
Oh,
Yeah.
Lord.
Yes.
Yeah, you
That's
should
when
get-
you've annoyed the physician.
Yeah.
You should get around 3 grams of omega-3s in your diet daily. So,
I take the stupid fish capsule. You try and swallow it, so God help me if it breaks in my mouth.
Sometimes it repeats on
Oh,
itself.
yes.
It's Yahoo. But all of these things have an effect for the chiropractor and the chiropractic adjustment. So I think in today's world, chiropractors are really more concerned about not just treating the spine, but also treating the whole body. And from a point of view of very natural, try to stay as non-invasive as possible to do that.
Now,
work.
you brought up something, it was profound, where you said you find somebody you trust.
Yes.
And it's amazing because everybody from your primary care physician to the OBGYNs, I mean, you go through all of it.
Yeah.
And they say the best advertising is called the soccer field.
That's right.
Because when people move into town and they're standing on the soccer field,
They're talking.
they're talking. They'll say,
Who do you go to for this?
yeah.
Yeah. And that's the best way of finding people. Now, for us, for me especially, and Dr. Mark is getting the benefit of this as well. I've been here for 33 years, and I've developed a lot of relationships with physicians and practitioners around the area, so I have a wealth of folks that I can refer to, and that helps when people are coming into the office that are new to the community, that if they find me, I can help them find many times what else they need, dentists and physicians and
Yep.
physical therapy.
That's what I find that's hardest for me, starting out new, only 2 years into this profession, is I don't know, like the people around, the people to send like that are good. He has more of experience of who to send for this condition, who to send for this type of condition. That's I didn't get that in school. So
No, but that's just, I
that's
hate
just
to say
knowledge.
it,
It's
that's just
this-
being
yeah,
here.
That's it.
Exactly.
And listening to your patients saying,
right.
hey, Dr. So-and-so, is great.
Yes.
I mean, when I tore my ACLs, I asked around, they said, Mike Vasquez.
Yes.
I don't know him. I swear by him now.
Yep.
He's taking care of both my knees, and he told me that either he's going to cut up one of my tendons to put into ACL, or go kill somebody and get a
Yeah.
cadaveric.
Cadaver. That's
Yeah.
what I did.
Yeah.
Really?
Yep.
Well, I told him if you're going to go get a cadaveric one, kill a young one, because at least I want one young man's part in me. All the rest of my parts are old. At least I can have one young man's part,
Yeah.
holding
Yeah,
my
yeah.
knee
Yeah.
together.
That's true.
Yeah.
But again, that was word of mouth.
It's the best way of finding your way to the chiropractor that you need. Of course, sometimes you don't have a fit. What's good for Dr. Mark or good for Al may not be good for me. We may not hit it off personally or whatever. But for the most part,
So I need a chiropractor,
yeah.
whatever reason. Somebody tells me Nick Julian, somebody says John Smith, somebody says Toby Jones.
Sure, it's a little bit harder today than it used to be.
I call up.
Yeah.
What do I ask? What kind of questions should I ask it to make a decision of the three I was given, who to select?
Dr. Nick Julian, Dr. Mark Mazzuchelli would be
The first one, yes. Okay. So
but-
by default, that's the one to go.
It's hard to ask those questions. You might want to ask what sort of technique they use and things of that sort. But really, most people that are calling, they have no clue as to what it is that chiropractors do. What they know is that they had a friend who had a similar problem, and they went to the chiropractor,
Okay.
and
Then
they
let's
did
take a
something.
step back. You're in college or you're in high school.
Yes.
What are the steps to becoming a chiropractor?
That was a long time ago for me.
So yeah, it might have changed.
Yes, I
a
remember.
little.
You call Paul Revere. He's
That's right. That's right. We ride together.
So I had to get a pre-med, a bachelor's of science. I went to Bridgewater State University. Went to a state school, a little cheaper, because I knew I was going to be in the long haul with the education. So I had to do 4 years of that of undergrad. Then I went to National University of Health Sciences, one of their satellite schools in Florida that was open for about 2 years at the time when I joined. And they have different plans, like how fast you can take the courses, and the fastest you could take it was 3.5 years. So you got 4 years of
So it's
undergrad.
just like med school.
Basically,
much.
yeah.
Pretty
I
much.
mean,
And-
I think about Holy Cross.
Yep.
You went for 4 years.
Yep.
A lot of my friends, and they took the pre-med track.
Right.
They then took MCATs or
Right.
some
We don't-
kind of.
yeah,
you don't
that's-
need that for
no, yeah.
chiropractic.
But for the medical
Yes.
school, they had to take an entry.
Yes,
It's
they
kind of
do.
like
Yeah.
SATs
Correct.
for med school.
Yep.
Correct.
And then they'd have to do 3.5 years of med school. And you're doing the same thing.
In the first year of chiropractic school is basically basic sciences. So I had anatomy and physiology. We did a full year of cadaver, which
That's just like
is
med
that
school.
which is that
Yes, it is.
where you got that ligament from. The cadaver, basically, it's a person that gave their body up
Organ
for
donor.
science. Yeah, and it was a great learning experience because I could see every part of the body, the muscles, the nerve bundles, and everything. It was a really good experience. We also did microbiology. We did regular biology. We did chemistry. It's all that same program that you get in medical school. It's the same in chiropractic school.
Some differences. We don't study pharmacology.
I did.
Really?
Yep.
Oh. And surgery, we generally don't study much about
Well, you're not going
surgery.
to prescribe generally, and
No,
you're not
we
going to
don't
do
prescribe.
surgery.
But
right?
my professor for the anatomy, one of them at least, was a surgeon. So he was actually showing us surgical techniques, like how to stitch together an intestine. It's just cool stuff like that.
Well, I mean,
you know?
I can see the pharmacology because I could be taking something
Yes.
for another indication that works against what you're doing.
Yeah. Today's world now with record keeping.
With
now,
e-records?
yes, we have to keep all the drugs, all the medications that you're taking, and have a generally good idea about how they work and what they work and what to do if you see a change or a difference, and know when to refer back out. But when I went to school, the only thing we really studied much about was toxicology, not any pharmacology.
But now, on the record keeping, I mean, we're seeing a trend with MDs, that is, they come out of med school, rather than take on the onerous task of trying to set up their own practice and deal with all the administration and the bill collecting. They go to places like Phil Sermacoli has Tri-County, where they now join an organization.
Yes.
It's already established.
Right. I mean, I think he's got 90% of the primary care docs
Yes.
in the area, because, let's face it, they don't make enough money for the time they put in.
Yes.
And the time they put in, they're doing it because they have a passion for being with patients.
Yep.
So it frees them up. But my understanding is you don't get these huge chiropractic practices.
You don't. You don't. And it's a big difference in how medicine and chiropractic has evolved over time. We should be part, I think, of the medical community a bit more and work within that framework.
Yep.
I think we could have a beneficial effect both for patients and make it a lot easier for
Well,
us
but you have to go through the same insurance rigmarole, don't you?
Yes. Yes, it's all the same, and the record keeping is the same. We're held to the same standards. It's just that most of us, as chiropractors, do it independently. Or we may have offices that are 2 or 3 chiropractors strong, but that's about it. That's about it. There are very few, very large groups that I can think of.
Yeah. Florida, because I went to school in Florida, so down there they had a little bit more multidisciplinary practices where you have an MD or a DO with a physical therapist, a chiropractor, a massage therapist, all in the same office, which it's probably the most ideal way of treating a patient. You get the most benefit.
I'm just thinking of you with the overhead. Because, I mean, you got to have somebody to fill in all the Medicare, Medicaid forms.
Indeed you do.
And I think that's what, 40-odd% of most people's practice?
Yes, indeed. Some practices even higher than that.
Well, I've had a lot of the primary care guys tell me I could fill my practice with Medicare, Medicaid, and go right out of business because it doesn't even cover.
It doesn't pay. And but now you don't have to have, for us as chiropractors, we don't have to have such a large staff to do that. The computer programs are doing everything forthwith. You still need somebody to make sure that everything's coming in, it's all going out the way that it's supposed to go out.
You still need somebody to call Mrs. McGillicuddy
You
for
sure
a
do.
$12
Yep,
copay.
You sure do, but you don't need 13 of them like we used to have, right? Now the record keeping is a lot easier. We use an EHR that
ChiroTouch.
that
Does that get shared with the medical center at all?
It can. It doesn't at this particular point, but it has the capability of doing so. We need, as chiropractors, as a profession, to learn to coexist in a better way with medicine, and to develop relationships where we can work together rather than working apart.
Now, chiropractor, is there one level? It's not like you have an optometrist and an ophthalmic surgeon.
There are some differences. There are specialties in chiropractic. There's specialties
There's
in
all
neurology.
kinds. Neurology, sports medicine. They're called diplomates, right? Diplomates.
Yes.
That's when you specialize. So you actually go another, 2-3 years to specialize in a specific field. almost like a optometrist or.
You're going to be like an MD. You're going to come out of school when it's time to retire.
Exactly, yeah. Yeah. It's just a different way.
And then you work till you're 103, right?
Paying off the school loan.
Yes.
What I learned as I got into this profession is that we tend to treat our patients a little differently than the medical field. Instead of giving them a prescription drug right off the bat, we tend to do a more conservative type of treatment in terms of like, I do a lot of muscle work per se. So, and the muscle work meaning I break up muscles that are knotted up, basically, that have muscle adhesions in there. And that just, it makes the adjustment hold better a little bit. So there's different fields that you can get into. But in terms of what we try and get to the root cause of the problem instead of giving you a drug.
So now when I call you, am I looking, look you up on the internet, or am I looking for a certification? Is there some level of comfort I get if I see that you're board certified or
Perhaps,
something?
Yeah.
perhaps, yes, but again, too, the chiropractors with the alphabet
Yes.
at the back of their name, they tend to, they're generally the diplomats in orthopedics or the diplomats in
Okay.
neurology. We even have a diplomat in radiology. Yes, that might give you a little bit better feeling, but I think that what most people find with their chiropractors now, that it is more on the model of the old GP, where you develop a relationship personally with the initial patient and then usually develop relationships with their whole family. I have patients that are coming to see me that I have seen for 33 years, and they've brought their grandmothers and their kids kids now are coming into chiropractic as well. So it's a different model than what medicine is today. And I think it's the nicest part about being a chiropractor, that we have a little bit more time.
So you're not in that, you got 14.3 minutes
No,
per
sir.
patient,
No,
move them
sir.
up, get them out?
No, sir. We have to be timely,
Yeah.
Well,
obviously, but it's we get to know who you are, who your family is, and if Johnny or Emily graduated, where's she going to school and what they're doing, and it's more time afforded us as chiropractors than the poor medical physician that is harried.
I mean,
and
we
sees
laugh because we've had a lot of the MDs on the show.
Yeah.
And, you know, when we grew up, you were either a Cicchetti, a Mastriani,
That's
a
it.
Capi. You had
Yeah.
4 physicians that brought everybody into the world.
That's
So
right.
you're one of the 4 flavors, and there was no question.
And you pretty much went to them for everything
Yes.
that affected you in life. You broke your arm, you went,
You
Dr.
went to them
Cicchetti.
first no matter what.
Absolutely. So it's still somewhat like that in chiropractic today, that we do have an opportunity to spend a bit more personal time one on the other. But and today, I think today's chiropractor is much more likely to know when a referral is necessary and who to refer to, and has a wide net of professionals that they can suggest
Now,
for their
Mark, you
patients.
spend a lot of time on sports.
Yeah.
What's that about?
So I kind of just fell into it because I got a job right out of school with a Dr. Gilman in Natick, who had a diplomate in sports medicine. So he was really knowledgeable, and he showed me a lot of different sports medicine type of techniques. The way I was just kind of describing with the muscles and how you get a more functional tape. We do kinesiology taping. I'm certified in. I don't know if you're ever familiar
So
with
you
that.
see the funny
colored tape.
colored pieces of
Yes.
tape.
Exactly.
Yes.
Yeah, that's sports medicine field. We do Graston technique, which we go in. It's a metal instrument, and you get in there and you can break up those muscle adhesions that I was talking about.
Now, a muscle adhesion.
Yeah.
Help me
What is
understand,
it?
because most people, you know,
Yeah.
if you've ever had a massage, they'll say, "Oh, you're really knotted
Knotted
up."
up.
You knotted up.
I don't know what that means, but
Yeah,
yes,
they-
I'm miserable. That's why I came
It's
here.
a good way of describing it, though.
That's what an adhesion
yeah.
is.
Yeah.
But-
So I tend to describe them and tell patients about them like you think of it like a rope. If you have a rope that's all knotted up, has knots in it, it can't elongate to its full capacity. just like a muscle. If there's knots in a muscle, it can't function correctly and elongate. So what I do with those instruments and other techniques, I do ART, same principle. You get in there and you break up those knots in the muscle, free them up so the muscle can elongate fully and function.
But Mark, when I think of an adhesion,
So
I
yeah,
think of scar tissue that's literally.
Yes.
yep. So how they form, it's when you think of when you either work out or it can happen just by your daily life. You're going through your daily job or
You've overstressed the
you
muscle in
overstress
some
and
way.
you have micro tears in the muscle fiber. And then when that happens, it's almost like spaghetti. You know how spaghetti can be sticky and stick to
Yes.
each other and cause a little knot in there? That's the same way a muscle fiber can get knotted
Now
up.
that makes sense, because I
Yeah.
never thought of micro tears.
Yeah.
Tiny,
Because
tiny little things.
Yeah, but you get enough of them, the Lilliputians
And they add up.
win.
They add up.
They do, indeed.
They accumulate. And they can sit there for years.
And they can be broken up. And then you stretch the muscle and work the muscle out to eliminate those adhesions. And Dr. Mark does a lot of work with Graston technique, which uses a stainless steel instrument to help break up those adhesions. He also uses a technique called ART,
Yep.
where he uses his hands to break up those adhesions. Massage therapists do a certain type of massage that help to break up adhesions as well. But these techniques go much deeper into the tissue than what a massage therapist would normally do.
More specific towards a muscle.
And then there's exercises and rehab that has to go on along with that.
Yeah, it's not just show up, you
Yeah.
fix it.
That's right.
It's not take a pill, I'm now cured.
Yeah.
Yeah.
And so we give guidelines on different exercises to do at home, how to better your posture, correct your postural abnormalities. So you have some homework too after you come visit with us.
Runners do great with this. If you're a runner, your ART and Graston techniques make you feel like $1,000,000. Triathletes, cyclists, they all do very, very well with this
How
sort
about
of
fat
treatment.
old men?
Fat old men too, because they have adhesions
Yeah.
as well.
I was gonna say,
They tend to take a little longer to respond,
Yes,
but
especially
they get
the ones
there.
above the neck. Then it's,
So when you think of the athletes that come in, what is the most, where do you put most of your time on
And-
athletes, in treating athletes?
In area or sport, different type of
Well,
sport.
let's take both.
Area, well, it can be basically anywhere. I was just talking with Dr. Julian today. Golfers, you wouldn't think it's much of like a physical type of
Yeah, but they
athletic.
twist and-
that it's repetitive, and that's what gets a lot of people is the repetitive type of motion. Even just going through your daily life, the driving, long periods of driving, get people's low back. Just because the car seats are, and they're leaning against the steering wheel in a certain way for a long time gets them. And it's low back usually with that case. And then with golfers, tennis elbow, even though it's called tennis elbow, the lateral epicondylitis, the wrist extensions, because when they golf, they tend to overextend and they keep doing it repetitively, causes a lot of inflammation right in that
So it's like the old
joint there.
carpal tunnel idea that
carpal tunnel.
it's
yes.
not anything you're doing severely,
Right.
but it's the repetition.
Yes. I see it.
holding your body in that particular position for a while. But the actual treatment, you might have someone that comes in for hip pain. So the Graston treatment and the ART may go right to the hip and to this.
See, I never thought of that, because I always think of a chiropractic treatment as dealing with my spine.
Always does.
But my bum doesn't feel like part of my spine.
It's connected to your spine.
Yeah.
But the chiropractor will always adjust your spine as well. So we may be looking at a functional issue with your hip or with your leg or with your arm or your shoulder, but we'll also be addressing the fixations.
You're also going to check the oil and
Absolutely. Make sure
fluids,
that
like-
everything is done.
Because the nerves come from the spine. That's where they originate. So it's important to get rid of those restrictions so you have proper nerve function to the
Just like when I
extremities.
bring my car in, even though Ray's looking at this, he always checks everything just in case.
Everything, and he's good at checking everything
yeah.
too. Yes, he checks it all. Make sure you want to make a safe car, and you don't want to be coming in 30 minutes later because he left something
So
out.
elbows for golfers.
And pool
and-
players and
and-
typists and
I never
absolutely
think
You get
of
it all.
pool
Yes.
You
as
get it all.
a physically exerting.
It's not.
It's that repetitive.
It's
it's repetitive.
and it's repetitive, and that's what happens. Yes, ping pong players, absolutely. What's new now? I think the
Texting and
texting.
Oh, the neck.
You know, it's all.
I've
from-
read about that the
Yes.
kids are suffering because
Absolutely.
their head is down.
Yep.
Yes.
It's an
We
interior.
used to worry about kids wearing backpacks that were too heavy. for
Yes.
them. Right now, we have to worry about the backpacks and their head looking down all the time at their
And that really pulls you
iPhone or
two different directions.
yes. It's
Wow.
different. So structurally, we all, as chiropractors, we're going to look at the structure of your spine and the structure of your body, and we're going to address those things that help structure, muscles, ligaments, tendons.
Yep. And a lot of times too, people come in, it's my low back, and then you dig it a little deeper, and it turns out to be your butt muscles or your gluteals are the issue, not so much the low back.
Your bum can
Yeah,
have.
yeah, because it's in the same vicinity, and they go my low back, and they point right to their hip area, and
The only problem I've ever had is there's too much.
Yeah.
The mass is the issue.
yep.
Yes, but it's true. I mean,
It
people.
is the
can
largest
say-
muscle you have.
It is, and it's, you know, people will come in and say my hip hurts, and they'll point to here. Well, this isn't their hip. The hip's over here, right? But it's their SI joint. It's their glute muscles, and it all has an effect on everything above it. So too, if you have a problem with your foot, if you're flat-footed, or if you have a sprain or strain to your foot, it affects everything up the kinetic chain.
Yep.
Okay, so you could have a problem that starts in your foot, but you're feeling pain in your low back or in your knee or in
Well,
your
that
hip.
makes sense because if I'm favoring, how many times?
Absolutely.
You're gonna
Right.
offset your gait or your walk,
Right.
the way you walk, to avoid that pain, and that puts extra load on different points of your spine and joints. Because if you don't have full range of motion in that ankle, knee, or hip, other points of the body, other joints have to take up
Yeah,
extra
it's
slack.
interesting because more than once, you throw yourself down, you lay down to block a shot, and you get an 80-mile-an-hour puck cracking you off the ankle.
Yeah,
Now you're hobbling for a few days, and you can feel the pain
exactly.
up here, and it's like, well, wait a minute, I didn't get hit up here, I got hit in the foot.
Right.
And 30 years of that,
Yes.
okay,
Yeah.
has a deleterious effect on the whole system. So you may be feeling pain in your back, and you may be feeling pain in your other hip or whatever, but it all kind of runs back down to what's the base like. Is your foot an issue? Did you injure yourself? Did you break or fracture your ankle at
Yep.
some point in your life?
I see it a lot with people that break their ankle and they are in an ankle boot for 6 weeks, and that throws off their gait,
Changes your
walking
gait,
funny.
right?
Oh, yeah.
And then they come in with low back pain. It's usually low back and their glutes and hip too. I find out, yeah, that's usually what happens. I see
It's
that a lot.
interesting because maybe 15 years ago, I hit the boards hard.
Yeah.
I knew I was in trouble when I'm laying face down. I look over and one skates this way, one
Bang,
skates that
huh?
way.
Really?
Because both bones had broken.
Yeah.
Yes.
Oh,
And they had to do the pins and the rod and all. And it was funny because after a while, again, up here
yep.
was where I was feeling pain. I'm like, but I broke the leg off down there.
Right. It's usually the opposite side.
That's what I'm saying. It was
Yes.
there and it was here.
Mm-hmm.
Changes because your body has to acclimate to the change. So it puts more stress and pressure on one side or than the other. And think of all those years. I mean, you're a smart guy, but you went back to playing hockey, right?
Well, yeah. Not
So-
that smart.
So, we keep injuring ourselves. And we keep injuring ourselves when we're young, and our bodies are very adept at
Yeah, you
getting
bounce.
better, getting better.
Yeah.
But when you're in your fourth, fifth, and sixth decades, hello, that's a little
Yes,
bit
I
different.
don't bounce anymore.
No.
Now, I've got to ask you, sensitive question.
Yeah.
Why do you have to make that god-awful noise around my neck? I mean, if you think of any, and it's terrible to be
that's just-
stereotypical, but
Right. That's-
when you think of a chiropractor,
That's
I think
usually-
of somebody grabbing my neck
And yanking
and
it.
twisting it till I hear
Crack.
and then I pray, please
That it's
don't
still
tell me it didn't break.
attached.
Yeah, it didn't break. He didn't break my neck.
You're watching too many movies.
Yeah.
Well, on TV, that's all I see.
It's music to my ears. I
Yeah.
got to tell you, every time I hear that release and that cavitational pop, it's like a symphony.
Well,
for
people
me.
tell me gangster rap is music to somebody else's ears. It don't
So,
feel like
I
music to
hear
me.
you.
What is that noise?
So that noise, it's not actually the bones rubbing on top of each other, the joints. It's not actually that's causing the noise. It's the joint capsule, the gas exchange inside that joint capsule. This stagnant gas that's been sitting there. So when we undo that restriction, the gas exchange, that release, that's what makes the audible cavitational popping sound.
You don't have to have that in order to have an adjustment, by the way. And that's what chiropractors do. They deliver an adjustment to a joint. You don't have to have that pop or snap or crack. It's most commonly associated with the manipulation, but you can have a solid manipulation of a joint without ever having that noise. There are some techniques that use a handheld instrument that will deliver a metered thrust where you don't hear it pop or snap or crack. So some people like you that hate the idea of hearing that sound can still come in the
I've
office.
just been conditioned watching TV when they grab somebody and they snap their neck.
Yeah.
You hear that.
Yeah.
Yeah.
You know, so Arnold Schwarzenegger
Yes.
has just broken somebody's neck and they make the sound.
Yeah.
When I hear that sound, it just doesn't bring really fond
Good
memories.
thoughts. Good thoughts, dear. Yeah.
And-
I've never seen anybody actually break someone's neck doing that.
Yeah.
Really?
Yeah.
Oh, that's
it's,
good to hear.
It's pretty hard. And
I'll take your word for it. I know.
There's chiropractors that just practice that one technique, that just adjust the occiput, the first vertebra in the base of the skull. Just that. That's all they do. They don't adjust any parts of the spine, other parts of the spine.
Now, motion in your neck, does that get
yes, it gets
restricted?
locked up. Sure does. Sure does. And that's an interesting point that there is a segment of chiropractors that will adjust one joint in the spine.
That's it?
That's it. One joint in the spine. In fact, years ago, that was the only technique taught at Palmer College of Chiropractic was toggle recoil technique that adjusted the first cervical segment, and that's it. If you had a back pain down the lower part of your back, adjust up here. If you had a neck pain, adjust up here. Pain in the middle part of your back, up here. I don't know that I can't see how it is functional that way, but I am a whole spine adjuster. I adjust every joint in the spine, but there is a whole
Well, I can see the
segment
point
of
that
chiropractic.
adjusting, I went there because I got a shimmy in my tires, and he adjusts the alignment.
Yes,
Well, it's better.
yes.
I think what I'm hearing from you is it probably did result in a better outcome,
It
but
does.
not the optimal outcome of adjusting everywhere in the spine.
To my mind.
That's
That's
my
true.
understanding as well.
But there are chiropractors that would say adjusting the first cervical vertebra is all you
Plenty.
need done. All you need done. I don't hold that same opinion, but
I
there are
find that
some
hard
that
to
do.
believe when you have all the other joints to deal with.
Me too. But there are practitioners that have been doing it for over 100 years. Not a single practitioner, but it's
Right.
been around for 100 years. And there are patients that go and swear that this is effective for them and good for them, and they
God
love
bless
it.
them.
yeah.
Now,
So-
a disc. You hear that people slip the disc.
Yeah. This doesn't really slip. It doesn't like
Where
go
does
out
it
of
go?
place. The disc has a couple of parts to it. And the outside part is called the annulus, and then there's an inner portion of it that's more viscous and jelly-like. It's kind of like a jelly donut. That's called the nucleus pulposus. And what happens with a slip disc is usually that the jelly-like substance in the middle extrudes out or finds a way out, usually to the back portion of the spine. And that can cause compression directly on a nerve root or the spinal column, which which can cause some significant issues with radiating pain, even some difficulty with.
So you're literally causing a hole in the disc.
It's kind of like that, yeah. It's more, it's a tear.
Or a thin
It's
or a
more of
tear where-
and the inside part finds its way out.
Now it's constriction just from
It can
spatial
Compression, yeah.
compression.
Yeah,
Sure.
right. On the-
And sometimes that little jelly part that comes out can snip off and go floating around the spinal canal, and it can affect you on one side
I was gonna say, that's
today,
not good.
and then
That's
on
like
another
having a
side.
leak
Exactly.
in your house, and it's leaking
Pretty
over
bad.
here, but it's really
falling all
traveling.
over the place. Yeah,
And that jelly-like substance is very inflammatory too.
it is.
So sometimes it's
What is this jelly-like substance?
nucleus pulposus.
It's a viscous material. It's thick,
Yep.
but it's compressible.
Yeah.
So it actually acts in like a teeter-totter inside the disc. And it's usually very well contained. Because
So it's like a little
there's
shock absorber.
It's a shock,
like a
pretty much.
horizontal shock absorber.
Yep.
Pretty much,
Yep.
and it helps the joint to move in a circumductive motion.
So now, can you, as you're feeling, tell if I have that kind of problem?
No. No, to know absolutely, you need some radiographic evidence. MRI
Okay.
is most
Yep.
usually what we
you
do
see it.
today.
Yeah, you can actually
Yeah.
see the disc on MRI. X-ray, not
so much.
Yeah, you can.
No,
you
but
can see
it's
this-
your feeling along the spine.
Well,
You can feel something
not
not
the
quite
disc,
right.
The restriction in
the
the
restriction
joint.
Right.
in the joint. Generally, we're going to start thinking in that direction by the symptoms
Yeah.
that someone would be coming in. If you
I'm
told
just
me
thinking,
that
you do your thrust,
Yep.
and I come back and say, Nick, it didn't help. You
Yeah.
do it again, it still didn't help.
Yes. Well, and if you had specific symptoms,
Yeah.
radiating pain down into your leg or into your arm, or
I got a weird
things-
radiating pain that has no obvious source,
and
and
it
Right.
doesn't get better with conservative care, MRI. Now, even sometimes an MRI will come back maybe with a disc bulge, or most usually it's going to come back with arthritic change and things of that sort. That still is not the slip disc. It's still not a herniated disc, but it can mimic the symptoms quite
But if you get a real herniated disc, you're talking real surgery.
Most times. Most times.
It's
Not
bad
always.
enough.
Not
Well,
always.
Like I said, it's time sensitive in some cases, where that your body has to eat up that inflammation, knock it down, and that's the inflammation. That's what actually causes the pain too, along with the compression too. It'll irritate the nerve roots and spinal cord. That inflammation, because it's your body's reaction. Your immune system's trying to. It's almost like a foreign entity, like a
It's not
bacteria.
quite a foreign body reaction, but an inflammatory response was created for a reason.
Exactly.
It's trying to tell you, I'm not happy with what you did.
Yeah.
right.
You know,
Or
and
what's going on.
What's going
Say
on?
something's up.
My wrist hurts.
Yes.
Don't keep doing what you're
Exactly.
doing.
That's right.
Because
That's right.
it's not going to get any better if you keep repeating the same
right.
issue.
Yeah.
That's right. So bulges in the disc frequently respond very well to chiropractic care.
I'm going to say, you can
You
nudge
can
'em.
adjust it, and there are other types of chiropractic technique that uses traction and distraction to help reposition the disc so that there isn't compression. Herniations.
Very effective. Yeah.
Direct herniations, and especially free-floating fragments, are much more difficult.
Now,
for
you
us to
used
treat.
a fancy word that began with a K when you said it's a kinesiology or...
Oh, kinetic chain. The kinetic chain, is that
Yeah.
is that what you mean? The kinetic chain just relates to the chain of muscles, ligaments, tendons,
Yep.
and fascial
Fascia.
tissue that move all the way up and connect your whole body.
'Cause I've heard this word kinesiology.
Kinesiology.
I mean, this fancy word means what to me as a layman?
It's your body in space, right?
Kinesiology.
Yeah.
But the kinetic chain is in order for this muscle to work, then it has to relate and work with the muscles down
Right.
lower.
And
And that's all the way up the
So if
spine.
I
and
throw one
crosses
off
over.
balance,
Everything
the
else
kinetic
will-
chain
Yep.
is going to
Gets
get disrupted.
disrupted.
Yep.
But what is this kinesiology?
Kinesiology, that's a special field, and going after that chain of actions of a muscle hurting here, like we were talking about with the ankle boot, where your kinetic biomechanics is off, and it can affect your right shoulder all the way up, even though it's down on the opposite side of
So
your foot.
Nick talks about the kinetic chain.
Yep.
And somebody else uses a higher level word, but it means the same
The same thing, basically.
You're looking at the interaction of saying you can't compensate for your foot and not expect somebody else to pick up the load.
And say
Exactly.
hello and say, I've had enough of this, or you have pain. So in order to treat the whole patient as a chiropractor, you come in with a foot issue. We're going to look to the knee, to the ankle, to the hip, to the spine, to make sure that everything along the chain is functioning as
Now,
it should.
once a year, twice a year, my primary care physician says, I want to see you.
Yeah.
I want to poke and prod you and just check you out.
Right.
Yep.
Do you do that?
I do. And there are chiropractors that differ. In my practice, the way I generally practice, I would like to see most people 4 times a year. Some chiropractors want to see you every month. Some chiropractors leave it up to the patient.
Yep.
You come back when you want to.
I tend to do it more for their condition. If
Yes.
you're in an acute stage or you hurt yourself, I like to
No,
see.
if I got a problem,
Yeah.
I understand.
Yes, but
But
in general.
My primary care, it's not if you have a problem, come visit.
Yeah.
Right.
And I'm thinking, where you say I start to get these micro adhesions from the micro tears, and it would seem like it would be better if you dealt with it
Pretty proactively.
before.
Yes.
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 A few Lilliputians got together and
That's right.
formed an army.
That's
Right.
exactly right. And,
Yeah.
and that's what we try to do in our practice is not only treat the acute case, but try to keep you from
Yeah.
So
needing
now,
that.
how do I get a hold of you guys? If I'm watching the show, 6 loyal viewers watching them, the show, one wants to look at chiropractic care. How do I get a hold of you?
Google.
What do I Google? Nick?
Chiropractors in Milford.
Yep.
Chiropractors in Franklin.
Yep.
And our name will come up there.
And the
too.
name
Is
is?
Franklin Back and Joint Care.
Perfect. Well, thank you.
Yeah.
Thank you for having us.
And as always, we have a wealth of talent in the Milford area. It's amazing what's come about since the little red building that we call Milford Hospital has grown up into a medical center and brought with it incredible options for care in the area. You heard, get to know your chiropractor on the soccer field, on the football field, wherever. Ask your friends, who they've used, who you trust, and then make a phone call. If you have nobody else talking to the chiropractor, make sure that you feel comfortable, but get treatment if you need it. And as
Absolutely.
always, may God bless, and may tomorrow be a better night than tonight. Thank you.
Thanks.